Hello, I'm Jonothan Earnshaw, Editor-in-Chief of BJS British Journal of Surgery. First, a very happy new year from everyone at BJS. I'm here to introduce you to the January 2018 issue of BJS. We've started the new year with a bang, lots of controversy. Sometimes surgeons are accused of promoting techniques or devices before they're fully proven. This year, we're in tune with the financial reality of many healthcare economies. How can we afford to continue to offer higher and higher technology treatments? Malik and colleagues believe that to afford new technology, we have to save money by giving up low-value surgical investigations or procedures. Their systematic review makes some suggestions which have become highly controversial, with much comment on both sides in social media. Please join the debate. We need to discuss which of the treatments, both surgical and medical, that patients should expect to be able to receive. In his leading article, Patterson Brown responds to the debate. He's not in agreement with some of the choices of low-value interventions and with the suggested possibility of significant savings, but he agrees that it is not unreasonable that some low-value interventions make way for modern treatments. In a second leader, John McPhee explores the management of patients with adhesions. He wonders whether it can be proved adhesions cause chronic abdominal pain. The science is certainly not very helpful, and conclusions have to be guarded. The randomized trial in the January BJS compares two different reconstruction techniques after pancreatoduodenectomy. 120 patients were included, and the primary endpoint was postoperative pancreatic fistula. Other highlights this month include a new MRI-based scoring system to predict how difficult excision of a rectal cancer will be. Escal and colleagues from Montpellier, France, describe a 4-point score. The operation is predicted to be challenging if the score is 3 or more. There are 3 vascular papers this month. Surgeons from Oxford analyse the outcomes of carotid endarterectomy or stenting over time. Death and stroke rates have gradually improved over the last decade after endarterectomy, but have stayed static after stenting. Kanapathy and colleagues from University College London believe they've found a tissue marker, connexin 43, that is related to the severity of varicose vein disease. The challenge is to show that the marker is affected by varicose vein surgery. And for the first time, I'm commenting on a paper from my own hospital. The Gloucestershire Aortic Aneurysm Screening Programme has been running for 25 years. Each year, men aged 65 are invited for abdominal ultrasound. During the 25-year interval, aneurysm rates have fallen from 5 to 1.3% in 65-year-old men. And on average, the male aorta has reduced in diameter by around 12%. If you think about it, that's an enormous epidemiological change, and evidence that 65-year-old men in Gloucestershire now have healthier arteries. A few other highlights to mention. Baker and colleagues have done a systematic review that suggests suture fixation of the mesh during laparoscopic ventral hernia repair is better than TACS. Surgeons from the Netherlands have shown no advantage in adding ilioinguinal lymph node dissection over inguinal dissection alone in patients with sentinel lymph node positive groin melanoma. And surgeons from Sweden have used their national register to conclude that patients with gallstones should have laparoscopic cholecystectomy before, not during or after Roux-en-Y gastric bypass for obesity, as having the lowest rates of complications. Finally, those of you who still get the paper version of BJS will find the front cover graced by a Caravaggio masterpiece, The Taking of Christ. A description of how this painting was found is included in the journal, but a longer essay about the painting is online. Surgeons tell us that these vignettes are of interest. Indeed, there seems to be a sort of bond between the surgeon-scientist and the artist. We're happy to publish similar material in future BJS. Before I go, let me tell you about a couple of further BJS highlights. In January, we will publish a virtual China edition of BJS with an introduction from Professor Chung Mao Lo from the University of Hong Kong Shenzhen Hospital. The issue contains Chinese papers published in the last 18 months in BJS and highlights the increasing number of high-quality papers coming from China. Later in January, we will publish a special issue of BJS on cancer surgery in the genomic era. This collection of invited reviews and submitted articles provides a state-of-the-art review of the subject and is entirely free to download and enjoy. And watch out for the February BJS, which will feature a leading article and selected original articles on quality of life and patient-reported outcomes, an increasingly important topic, particularly as we start to explore the value of our surgical treatments to patients in these challenging times. Thank you for listening.